Hello, my name is Dr. Andrew Craig, and the topic for today's lecture is going to be the functional movement screen, or the FMS for short. This is a very cool lecture. This is a very cool movement pattern screening assessment tool. And so I'm sure some of you have heard of the FMS, but we're going to take some time to go through it in detail today. So um, for anyone who's working with clinical populations with movement deficits, or for anybody working with athletes specifically, um, specifically, I know that a lot of you work with teams at the university. Maybe you've even run them through this FMS screening protocol. And so it's nice because it gives you a protocol that you can use to start to identify areas of movement deficits that you can work on. But before we dive into the nitty-gritty, I just want to give a special thanks and a special shout out to Vicki Grierson, who's a physiotherapist who really exposed me to a lot of this, and a lot of the content from this lecture comes from my discussions with Vicki.
So the game plan for today is we will discuss, first off, we'll talk about what the FMS is, what it's used for. We'll look at how the process works in a global or a general sense. Then we'll talk about the different tests that are involved. There's also a few different what we call clearing tests, which are designed to identify any sort of pre-existing medical conditions that are glaringly obvious that might get missed by the actual FMS testing protocol. Then we're going to talk about what you can expect in the lab, and I will give you some links on where to learn more about the FMS. I will say this off the bat. I'm going to give you a number of links to videos that demonstrate each of these tests. You are going to be responsible for doing these tests in the lab, in the fifth and final lab of the semester. I can't believe we're already at that point. So I suggest you watch the videos because they'll be very, very helpful in just giving you an idea of what the test entails. And then also on testing day, if you watch them, it will jog your memory as to how to make proper measurements and how to properly score the tests as well. Okay, so I'll give you the links towards the end of this lecture and in your labs. Just as a disclaimer for this lab or for this lecture, I'm not actually certified in FMS. I've done a number of, I've been involved in a number of FMS screening procedures and preseason testing situations. I've also done some work at the school in an undergrad project that I worked on using the FMS. So I'm quite familiar with it. I am not certified and I don't practice it on a regular basis. So I would recommend, I know that the athletic therapists, I believe, at the school do the FMS and complete the FMS on some of the varsity teams. So if you're interested in learning more, you can always look at the FMS website to getting certified. You can reach out to Dr. Nick Antony, who also does FMS at the school, and the athletic therapists at the school as well. The reason I think it's important to sort of expose you to the FMS in this course is because it's important for physical assessment strategies as a kinesiologist, especially if you're going to work alongside any athletic therapists or chiros or physiotherapists, or you're looking to work with sports teams. It can be a great adjunct to say, hey, listen, you've got, if you approach a local sports organization and say, I'm willing to screen all of your athletes in the preseason with the FMS, and then we can discuss potentially with you, myself, and the physiotherapist that I work with, some rehab protocol and some strategies and some corrective exercises that would be effective in preventing injury down the line. So what we're going to do today is we're going to specifically look at the movement patterns, and that's the tests involved with the FMS. I'm not going to expose you to the corrective exercises because that's sort of the copywritten and sort of the purpose of going to learn the FMS and learning those corrective exercises. But you should be able to use the FMS assessment strategies and what you've learned in this course from a rehab perspective to address certain issues within people's movement patterns. So what is the FMS, or the functional movement screen? It's this non-diagnostic screening test designed specifically for healthy athletes. Okay. It's designed to identify potential risks of injury and asymmetries that may become problematic for athletes in order to give them clear guidance on how to improve those imbalances and potentially prevent further imbalances from occurring, which could lead to injury down the line. So we're looking at motor control, we're looking at mobility, and we're looking at them within this confined set of testing parameters, which are really common to sport. And this makes them decently specific to athletic endeavors, but it also makes some of these movements a little more challenging for the average individual and general population. So it really is designed for a healthy athletic population. What is the FMS? The FMS is a testing protocol that consists of 7 common athletic movement patterns and 4 musculoskeletal clearing tests. Again, these clearing tests are designed to pick up any of those glaringly obvious and problematic medical conditions or injuries that might otherwise go unidentified through the movement pattern testing. Why would we use the FMS? Well, we want to use it to identify any sort of compensatory patterns and poor biomechanics that an individual may demonstrate with the intention of preventing future injury in those who are injury-free. Okay, so it's designed to try to reduce the risk of injury in a highly athletic population. Who is appropriate for the FMS? Again, it's designed for athletes who are pain-free. Anyone who has pain is actually eliminated and disqualified from being run through the FMS. It's got no validity in people with injuries. So there's no reason to apply this unless the person's injury-free. So that should be your first question. Are there any injuries that you've sustained recently? How severe? Have you had them assessed? To make sure that they're not wasting their time in going through this FMS. There is a modified version for less active individuals. Personally, I've seen it less often utilized. I see the FMS more as a performance tool for performance athletes. When would you implement the FMS? Ideally, you would do it sort of in a preseason scenario. Maybe you're doing preseason testing. Maybe you're doing screening for injury. You can also apply the FMS throughout transitions from rehab to return to sport for potentially clearing athletes from potential injury risk purposes on the field. It's also helpful to check in with athletes through the season, so you can do those pre, mid-season, and post-season reviews with them. From a global perspective, if we kind of take a step back and look at how the FMS works, item number 1, is the person healthy? If the person is healthy, then if they're healthy and they're active and they're an athlete, then they're likely able to be run through the FMS. Okay. This is where you can assess them using the FMS testing protocol, which we're going to go through in extreme detail. And then once you've run them through the protocol and you've sort of scored them on the scoring sheet, then you can identify any sort of asymmetries or imbalances in their motor control patterns and their mobility, and you can start to apply what's called corrective exercises to try to correct those imbalances. Okay. And within the FMS protocol, you've got these 2 concepts. You always want to, first off, protect the individual. So teach them protective strategies and use corrective exercises that are going to build up their tolerance against injury. And then you want to correct any sort of imbalances that may be identified. So first off, protect the individual. Teach them things that are going to prevent them from getting injured. Then you want to correct any sort of imbalances that you can identify. This is an example of an FMS scoring card, which you might use, and you can see all of the screening tests are identified on the left-hand side of the form. You've got the deep squat, the hurdle step, the inline lunge, the shoulder mobility test, the active straight leg raise, trunk stability push-up, and the rotary stability test. You've also got 4 clearing tests. So you've got the ankle clearing for pain, You've got ankle clearing for mobility, you've got shoulder clearing, you've got extension clearing, and flexion clearing. So there's 5 tests here, but really this one is just one test. Okay. You've also got a little bit of demographic information on the top. So their name, the date, their date of birth, the tibia height, hand length, which are measurements that are required for doing some of these tests. So before you go to lab, I want you to review the lab instructions, and it's going to tell you a couple of things I want you to be able to identify, tibial tuberosity being one of those landmarks. You'll also notice that this form has their raw score, their final score, and then comments for how they completed or how they performed on the FMS test. I believe this is open source. I believe you can get this for free on the FMS website. The website, I was just on it earlier today. It's fantastic for having, for getting any sort of resources associated with the functional movement screen if you're interested. So how do we score the FMS? So the FMS is scored on a scale from 0 to 3, okay? And it's an ascending scale from least functional to most functional. A 3, this is given when the individual can perform the movement without any compensation patterns, okay? Now there's established criteria that you're looking for, and if they can perform that movement within that established criteria, they're scored a 3. If they can perform the movement, but there's some sort of poor biomechanical or compensatory pattern that's happening, they're scored a 2. If they cannot perform the movement pattern, even with compensation, they're scored a 1. As long as there is no pain, they will always be scored a 1 or higher. If the individual has pain during any part of the movement, they're scored a 0. Now, if you score a 0 on any of the tests, you're supposed to stop the test immediately, and you're supposed to seek medical assessment from a professional. Okay? When you're running individuals through the functional movement screen, you always perform 3 repetitions of the movement. When you perform those 3 repetitions, you sort of score them all, and you keep the score of the best repetition. Okay. And again, I already mentioned this, but if an athlete does score a 0 anywhere in the test, you stop the test immediately and you have a medical professional assess them for injury. Now let's get into the meat and potatoes of the FMS. So we've got these are the tests that we're looking at. You've got the deep squat, you've got the hurdle step, you've got the inline lunge, active straight leg raise, trunk stability push-up, the rotary stability, and there's actually one more, which is, oh no, sorry, trunk stability push-up's already there. Okay. Which one are we missing on this? Deep squat, hurdle step, inline lunge, shoulder mobility. My apologies. So shoulder mobility is another test. Okay, so you've got the 7 tests: deep squat, hurdle step, inline lunge, shoulder mobility, active straight leg raise, trunk stability push-up, and the rotary stability test. Now, I will tell you this right off the hop. These 2 tests are the most challenging, so always leave them till the end, okay? The FMS, you really don't want to rush through. You're not trying to exhaust the individual. If you have them do squats, lunge, active straight leg raise, if you do all these very, very fast, you're going to exhaust the individual, and there's no need for that. That's not the purpose of this. You're looking for baseline testing, so you don't need to exhaust the person. Additionally, make sure that if you are running functional movement screens, you're advising the person to show up in comfortable equipment, just like I have it written at the top of our labs. Show up in gym clothes, shorts, t-shirt, athletic shoes, gym sort of attire, because it is an athletic movement, so they're going to be moving throughout it. In addition to these 7 tests, you've also got the clearing tests. Okay. Now, the clearing tests, as I mentioned before, these are designed to identify any sort of common injuries that might be present that the assessment tests miss. Okay. And so we've got 4 tests we're looking for. You're looking at dorsiflexion clearing test, which you can see here in the top left, the shoulder impingement clearing test, which is indicated in the image on the right. You've got the extension clearing test, which looks at the low back on the bottom left, and the posterior rock clearing test, or the flexion clearing test, which is on the right. So what we're going to do is we're going to go through the tests, and we're going to kind of sprinkle in those clearing tests as they're indicated within the FMS protocol. Let's start with the deep squat. Now, this is the part of the lecture where I have provided links for you. They're at the bottom. Sorry, the person who is narrating, the voice is very monotone, but they're actually excellent videos. They're very, very quick, and they go through each of these tests. Okay, the deep squat. This one is almost one of the most fundamental movement patterns. You've probably all done this in the gym. It's not really, functional in terms of everyday activities. People aren't picking up their groceries like this and squatting overhead. But the basic components within the overhead squat are very important within any sort of sporting context. So the instructions that you give to an individual is they'll stand with their feet shoulder width apart. They'll hold the dowel in two hands and rest it on the top of their head. Okay. They'll adjust the hands so that their elbows are at 90 degrees, and then press the dowel directly overhead, extending the elbows maximum. Now, the goal of this test is to keep the dowel directly over your head and to squat down in a deep squat so that your hips descend below 90 degrees. You want the dowel to not pass forward in front of the knees or the toes, and you want the individual to descend with their heels flat on the ground and then ascend back up without that dowel moving from the plane that it's on. It should go in a direct up and down line. Okay, so in order to score the deep squat, again, you do 3 repetitions and you score the best repetition. But in order to be graded as a 3, they need to keep their feet stationary on the ground. Their knees need to be over top of their feet in the frontal plane, or at least they cannot be falling in or collapsing inwards. The trunk needs to stay parallel to the tibia through the whole movement. So you can see here the trunk is parallel to the tibias. The femur needs to dip below 90 degrees, and their feet need to stay flat on the ground and the dowel within the base of the support of the feet. Okay, so that's what you're looking for to give this individual a grade 3 on the deep squat. So you're looking at a lot of different cues. In order to score a 2, so let's say they don't score a 3. Let's say the dowel moves way forward, like a foot in front of their face, or their heels come up, or their trunk has extreme anterior lean or anterior tilt, and so you can't justifiably give them a 3. What you do is you can there's a testing kit, which you can see in this image here. So this plastic piece here, the gray piece, if you slide the testing kit underneath their heels, this might allow them to achieve that movement properly. So if you slide the testing kit under their heels and they're able to complete this movement with the dowel nicely overhead and all of those other aspects, then they can be scored a 2. If they cannot perform a successful squat with the testing kit under their feet, then they will be scored a 1. If they have pain, obviously it's scored a 0. I might skip that. I might skip saying that throughout each of these tests, if that's okay with you. The hurdle step. The hurdle step is the second test, and you need the entire testing kit for this. So you've got 2 posts. This is usually an elastic band that goes across the tibial tuberosity, and then the dowel goes across the shoulders. So the individual, first off, you need to set up the proper height of the hurdle. Okay. What the tester will do is measure from the ground to the tibial tuberosity, and then there's on the dowel, there's actually a measuring stick, a yardstick on it. So you can use that to measure the height of the tibial tuberosity. And then there's measuring sticks on the side of the hurdle. You can set the hurdle to the appropriate height, which should be the same height as the tibial tuberosity. The individual is going to stand with their feet touching the testing kit. Okay. The dowel stays across their back as if in a squatting position. And what the individual is going to do is they're going to lift their foot straight up and over the hurdle, touch their heel on the opposite side, and then bring it back onto their side of the hurdle. As they do this, they must sort of keep their knee and hip in line, must not rotate through the hip to get clearance over the hurdle. They also need to maintain a stable base on the dowel. So the dowel needs to stay on their shoulders properly. In order to score a 3, their foot stays in a neutral position throughout the frontal plane. It clears the hurdle, and they keep the dowel parallel to the test kit, and their trunk is upright. If they deviate from this, but they're still able to get their foot over the hurdle, touch the ground, and bring it back without losing their balance, they can be scored a 2. If they're unable to clear the hurdle, but they have no pain, that's a 1, and then 0 is a painful hurdle step. The next test is the inline lunge, and I apologize for the wordiness of these slides, but I do think you need to kind of go through and read how to describe these or how to achieve these movements properly. The inline lunge requires the testing kit as well. Okay, you're actually going to stand directly on the testing kit, and so as you can see, this individual has their left foot back on the image on the right and the right foot back on the image on the left, which is confusing to say. But essentially, you grab the dowel at the base of your neck with your superior hand and in the small of your back with the inferior hand. Okay, so you're holding onto the dowel. That dowel needs to maintain contact with the back of your head, your thoracic spine between the shoulder blades, and the top of your buttock region. So in order to be successful within this movement, you need to maintain contact with the dowel, and the dowel needs to stay vertical the entire time through this movement. So the person fixes their foot at the 0, and their front foot, so in this picture that I'm circling here, their front foot steps out the same distance as their tibial tuberosity. Okay, so you measure the length, or you've already measured the tibial tuberosity, so you just measure it along the testing kit. That's where they put the back of their heel. Okay, their feet should be in line, so basically tandem along the testing kit. And what the individual does is they descend down into a lunge, an inline lunge, and they need to maintain that dowel against their back. They also need to maintain a flat-footed stance with their front foot. So in order to gain or to be scored a 3 on this, the dowel needs to stay in the upright and frontal plane and the sagittal plane. You need to maintain contact at all 3 points that I mentioned. The knee needs to touch the center of the board right behind the heel, and the front foot needs to remain in place. If you can complete a lunge, but it's not, let's say that the dowel doesn't maintain contact, or the heel comes up, the front heel comes up, this would be graded as a 2. And then if they lose their balance or they're unable to complete the movement, this is scored as a 1. And if they have pain, that's scored as a 0. This is where we integrate a clearing test, so a dorsiflexion clearing test. Now, the dorsiflexion clearing test, you need to use the testing kit as well. And so your feet are going to go alongside the testing kit. You're going to go heel to toe. Your heels need to stay anchored to the ground, so your heels cannot elevate off the ground. And you can use the dowel on your opposite side to maintain proper balance. Now, keeping your heels on the ground, you need to bend your knees as far as you can go forwards, and the tester will measure how far forward that back heel or that back knee can bend forward. So in order to grade this, since it's just a clearing test, we don't look at 1, 2, and 3. We just look at if there's any concern or if it's something you need to be address. So if the knee can come, if it goes anterior to the anterior aspect of the malleolus, the lateral malleolus, this is considered green. It's a gold standard, good dorsiflexion in that posterior ankle. If their knee only makes it, let's say, between the anterior and the posterior aspects of the lateral malleolus, this is okay. This is kind of what's expected, but it's not excellent. And if they can't actually reach the posterior aspect of the lateral malleolus with the front of their knee, then this is sort of a concern, and we should be likely looking to address the dorsiflexion in the ankle. Now, remember, this needs to be pain-free. If there is any pain, then we are considering some sort of pre-existing ankle injury that we need to address. Next, we have the shoulder mobility test. So this is the first one that really focuses on something that's not incorporating the lower limb in the FMS testing protocol. So with the shoulder mobility test, you've likely tried this. Most people have, to see what their internal and external shoulder mobility looks like. This is great for looking at the scapulothoracic rhythm. It's also great for looking at anybody who has a potential sick scapula, which we discussed a few weeks back. And so in order to complete this test, you tuck your thumbs inside of your fists. Then you slowly reach one arm overhead and one arm behind you, and you try to touch your hands between the shoulder blades. It's important to make sure that this is a nice, slow, and rhythmic movement, and the individual needs to be able to hold their arms there. Okay? The instructor or the tester will measure the distance between the two closest points between the hands. Now, in order to score this, we need to take a baseline measurement. And the baseline measurement is the length between the distal crease of the wrist and the longest digit. So for most people, it's the middle finger. This is going to be your gauge in terms of grading. So if they can come close enough that they're within one hand length from the distal crease to the edge of the longest finger, that's scored as a 1. If it's less than 1.5 hand lengths, that's scored as a 2. And if it's greater than 1.5 hand lengths, that's scored as a 1 and indicates probably some type of shoulder imbalance within their mobility there. So potentially scapulothoracic rhythm problems. If they have any pain with this, it's scored as a 0. Now, there is a shoulder clearing test. This one is very, very simple. The individual grasps their other shoulder or their other, you can get them to basically rest their hand on their opposite shoulder, and then they bring their elbow up. And if they can touch their face or their nose, this is the clearing test for basically impingement within the shoulder. The next test we're looking at is the active straight leg raise. And so the individual lies on their back for this test. They have their feet together facing upwards. They have their hands at their side also facing upwards. Okay. And you can see that the testing kit goes behind the knees. For the tester, what you need to measure is the mid-thigh. And so you find the mid-thigh by measuring the length between the ASIS and the joint line of the knee. So the crease or the joint line between the femur and the tibia. And you basically measure that, take half the distance, and that's where you can apply or put the dowel to see if the individual can pass that area. So the person lays on their back, and when they're told to, they will complete 3 repetitions of an active straight leg raise, where they're flexing at the hip and keeping the knee perfectly straight and trying to bring their leg up as high as possible. In order to grade this, if the individual can bring their leg past the midpoint, so between midpoint and their ASIS, then they're scored a 3. If they can only bring their leg up to, it goes past the knee, their foot goes past the knee, but does not pass that mid thigh, so somewhere in this area, that's scored as a 2. And if they cannot pass their knee with their malleolus, then that's scored as a 1. And if they have any pain, that is a 0. Now, the trunk stability test, this is where the testing gets pretty challenging. This one is essentially a push-up, but it's a very awkward push-up. So the individual is going to start by laying on their stomach. Their feet are maximally dorsiflexed and pressing against the ground with their feet together, and they're maintaining a nice planked position here. The hands start overhead, and the individual slides their hands down to about forehead height. Now, for males and females, there's a different measure here. So for males, their thumbs are going to align at the forehead. And for females, they're going to align at the chin. Once you've got your hands in place, then you lift your elbows off the floor, and keeping your spine neutral, you're expected to push yourself up with your elbows off the floor into a plank position and hold. If the individual is able to do this, and there's no rotation, there's no excessive lumbar overlordosis, there's no bending in the knees, they're not shaking like a leaf, then they're scored as a 3. If they cannot complete this, then what you do is you have them go back down, and you have men change their hand position from the forehead to the chin, and you have women change their hand position from the chin to the clavicle, which is a little bit less challenging for both populations. Then you have them elevate their elbows again, and then press themselves up into a stability push-up, and that would be scored as a 2. If they're unable to do either of these, that's scored as a 1, as long as there's no pain, and then it's scored as a 0 if there is pain. Again, do not go through these as fast as humanly possible. The person will be huffing and puffing by the end of this. It can be a good little workout if you go too fast. Now, there's an extension clearing test for this one. And if you've ever done any yoga, it's essentially a cobra pose. So you lay on your stomach and using your hands, you extend your elbows maximally and you arch your back while keeping your hips planted on the ground. And if there's no pain, then you move along. The last major test we're going to look at is the rotary stability test, and this is by far the most challenging. I encourage every one of you to try this in lab this week because it's quite humbling. So the starting position is on your hands and knees with your hands shoulder width apart, in line with your shoulders, and your knees shoulder width apart, in line with your hips. Okay. This is very similar to a bird dog position if you've ever done that exercise. The individual is expected to straddle the testing kit to keep them in line, and in case they need to transition from grading from a grade 3 to a grade 2. So in terms of a grade 3 position, everything's going to be unilateral. So the individual's in that quadruped position on their hands and knees, and then they shift all their body weight to the left, and you bring your elbow and your knee together to touch. If you can do that, then you extend your hand and your elbow all the way overhead, just like in this image here. And then you bring your elbow and your knee back to touch again, and that is 1 repetition. Okay. Obviously, you're going to do this on both sides. Now, this is by far the most challenging exercise. And so in order to be scored a 3, you need to be able to simultaneously do this. you need to be able to simultaneously do this and do it on it in a unilateral sense, so just on one side of the body. If you're unable to do this, then what you would do is your right arm and your left leg. And if you're able to touch your right elbow with your left knee, extend them overhead, and then touch again, this would be scored as a 2. If they're unable to complete this, it's a 1, and if they have pain, it is scored as a 0. Now, for this particular movement, the rotary stability, we have a posterior rocking clearing test or a flexion test, and this is essentially child's pose. Okay. If there's no pain, then again, you can move on. Here is an example of an FMS scoring sheet after having scored an entire test. What I want you to do is, if you can print one of these off and bring it to lab, I'd love for you to go through this with your group and score each other. And so you can see there's left and right columns, and there's a total. So the total is typically the lower of the two scores. And so you go through, you do the deep squat. Obviously, that's only a unilateral movement, so it's a 2. The hurdle step, you're going to score at left and right. Inline lunge, ankle clearing, you're going to go through each, and you can score each of those as you see fit. And that's the FMS. That's how you score the FMS. Those are all of the movements that you need to know for the FMS. Okay. Now, remember, what's the purpose of this FMS? The purpose of this is to try to prevent future injury in athletes. Okay. Now, we're not going to go through the corrective exercises. You kind of need to take the course to go through and learn all of the proper correctives. But depending on what mistakes the individual makes, or what biomechanical maladaptations they have, you will apply different correctives to try to achieve certain goals. You will also apply just general rehab principles that you've learned in this class and others to try to even out those imbalances and potentially prevent any sort of future injury. So again, the fundamental concept for the rehab strategy with FMS is to first protect the individual, then correct. And when you're doing corrections, you always look to improve mobility first. Okay, and we've talked about this as well. Mobility first. You got to be able to move properly. Then you look at static stabilization, so stability exercises, then isometric stability in particular. Then you look at dynamic motor control. So this is more complex movement patterns. Then you look at performance or sport-specific exercises as sort of the final return to play rehab concept. Okay. So that's what I want you to know about the FMS. I'm going to give you tons and tons of resources on your course website that you can look at. In terms of the lab overview, what you're going to do is you're going to be, the lab is going to be broken down into 2 sections. The first section is a complex movement patterning, basically seminar that you're going to run within your small groups. You're each going to be assigned a different, you're each going to choose a different complex movement pattern, and you're going to be responsible for teaching your classmates within your group that complex movement pattern. That's going to be the first portion of the lab. Might take up half an hour, might take up about 40 minutes. The second portion of the lab, your TA is going to assign you one specific movement pattern from the FMS. You're going to be responsible for practicing that within your group. You're going to be responsible for explaining the grading system, and you're going to be responsible for demonstrating good and poor examples of that. So what you're going to do is, within your small group, you're going to practice that, and then you're going to explain it to the rest of your class, and that's going to be your lab task for the day. Okay. Make sure that you review the FMS lab before you come to the lab, and try to watch some of the videos that are posted. These are the videos that I want you to sort of watch. They're 1 to 2 minutes each, so they add on a few minutes to the lecture, but I suggest just going through and doing them now as it's fresh in your brain. Okay. If you want to learn more, this link will take you to the FMS website, where there's a a large PDF with very, very in-depth descriptions of everything that we've discussed here today. Okay. Thank you for listening. I hope you enjoy the FMS, and I hope you enjoy this lab. This is actually the creator of FMS. He's a very happy guy, and this is clearly him having a great time at a seminar. Okay, so I hope you have a great day, and we will reconvene during the next webinar. Take care.